Thank you, Deputy Speaker. On the May the 1st, the Prime Minister held up his green card and declared, under Labor, all you need is your Medicare card, not your credit card to see a doctor. Well, Deputy Speaker, I can tell you this, that's not absolutely true in my electorate of Dawson. Because in Dawson, you can wave that Medicare card as much as you like, but unless you've got your credit card, you can't see a doctor. In Mackay, a regional city of 130,000 people, there is not one single bulk billing clinic. If you're not on a concession card, you cannot see a doctor without your credit card. In the Whitsundays, Bowen and Burdekin, the same story. Not one clinic. The nearest bulk billing clinic is in Townsville, an 800-kilometre round trip from Mackay. That's 8 hours of driving, more than $100 of out-of-pocket expenses for fuel alone, just to see a bulk billing GP. That's not Medicare, that's Medi-don't care. Deputy Speaker, all last week we heard that side boast. In my electorate we've got these bulk billing clinics. Frankly, I'm sick to death of hearing how Labor only cares about their own backyard. The people on that side couldn't care less about the community suffering under Labor's blatant neglect. We're not talking about tiny backwater towns here. Mackay has a population of more than 130,000 people, and there's not one single fully bulk billed GP. Medi fail. And yet, while regional Australians are struggling to access a GP, the government recently announced $10.5 million for 3 bulk billing clinics in Canberra. Canberra, the wealthiest city in the country, where the median household income is 30% higher than the national average. Meanwhile, regional Australians, the farmers, the tradies, the nurses, the teachers, are forced to fork out cash that they simply don't have just to get basic healthcare. The hypocrisy couldn't be any clearer. Labor talks about strengthening Medicare, but in reality, they weakened access for very Australians who rely on it the most. Let's look at the facts. People in regional areas are 50% more likely to delay or skip seeing a GP due to cost compared to those in the cities. This government loves to talk about record funding, but, Deputy Speaker, in communities like mine, none of that is reaching the front line. Since Labor came to office, out-of-pocket healthcare costs have jumped by 25% in the electorate of Dawson alone. Families and pensioners are paying more. They're waiting longer and they're getting less. That's not a healthcare system to be proud of. That's a crisis. And what's the government's answer? They say, don't worry, 9 out of 10 GP visits will be bulk billed by 2030. 2030! Well, Deputy Speaker, you tell that to a pensioner in Proserpine who can't get a doctor's appointment now. Tell that to a young family in Bowen choosing between groceries or a GP visit. They don't need a promise of 2030, they need a doctor today. Real Medicare is about care on the ground, not slogans in Canberra. You can't deliver bulk billing by throwing money at city clinics where regional towns go without doctors, nurses and clinics entirely. Labor needs a plan, one that recognises that regional Australians deserve the same access to healthcare as those in capital cities. Deputy Speaker, the Prime Minister says Medicare represents who we are. But I say this right now, Medicare represents the growing divide between city and country. The people of Dawson don't need slogans, they need services. Until this government stops pretending that Melbourne and Mackay are the same, that metro and regional health systems are equal, we'll keep seeing the same result. Regional Australia's paying more, travelling further and getting less. Deputy Speaker, it's time this government delivers Medicare that actually works for all Australians, because in the meantime, regional Australians will have to keep carrying their credit cards because their Medicare card, their little green card, is little more than a discount voucher.